He wants to privatize Medicare. He wants to voucherize it. He's voted consistently for Republican budgets in the House to do that. And you know what else he wants to do that's particularly offensive to me? And it's offensive because we all sit here and we dress well and we have good titles and we get paid well and we have insurance funded by taxpayers. He wants to raise the eligibility age for Medicare. So look around my state, Mr. President. The presiding officer grew up not far from where I live in Cleveland, Ohio. He knows his adopted state way better, but he knows my state still, and he knows what this means. If you're a barber in Garfield Heights, you got to wait till 67 or even to 70, according to Congressman Price, before you're eligible to draw Medicare. If you're a carpenter in Westlake, Ohio, you got to wait till you're 67 or 70 to draw Medicare. If you're working construction in Lima, Ohio, or if you're working a manufacturing plant in Mansfield, Ohio, if you're working retail in Cincinnati, Ohio, if you live in Zanesville and you wait tables in a diner, you're going to wait till you're 67 or 70 until you can draw Medicare. That's what Congressman Price wants to do. So not only are his ethics challenged, that should be reason enough that he should step aside. Buying and selling stocks, healthcare stocks, as a member of Congress while you're voting and helping those companies. That's bad enough. But what he wants to do to maybe the greatest program in American history, Medicare, is much, much worse because that affects people in those towns I mentioned, in Garfield Heights, in Westlake, in Zanesville, in Cincinnati, in Mansfield, all over. Because, I hope I'm healthy enough to continue working and continuing serving in the Senate, and the voters obviously would have to say that between now and then. I hope I can work till I'm 67 or 70 in this job, but I know a lot of people that work outside, that are on their feet all day, that work with their arms and their shoulders. They can't work till they're 67 or 70, and it's immoral. It is immoral for members of this body to support a candidate, to support somebody who's going, or to vote for something like this that will raise the Medicare eligibility age. I'll close with this, Mr. President. I was in Youngstown one day at a town hall, and a woman stood up and she said, she was clearly in probably early 60s. It turns out I could sort of calculate her age from what she said. And she said, she put her hand up, she stood up, and I called on her. She's about 200 people there, and she said, I work two jobs. I don't make a lot of money. I'm getting by. I work two jobs. Neither of my jobs has health insurance. And she said, I'm 63. My goal in life, think about this. The page is thinking about this. They're not thinking a lot about Medicare. My colleagues think, I'm 63. My goal in life is to live 18 months more so I can get Medicare. Think about that. Your goal in life, her life was such that her goal in life wasn't to get to know her grandchildren better or help her kids out or maybe take a trip to New York City or even Cleveland. Her goal in life was to live long enough to have Medicare. So, I'd like Congressman Price to actually meet her. And like Congressman Price to say, well, lady, your goal in life needs to be you can live 3.5 more years so you can be 67 or 70 to get married. I mean, think about the morality of this, Mr. President. Congressman Price, I know him. I don't know him well. He's a nice enough guy. But voting for somebody that wants to raise the Medicare eligibility age, that to me is immoral. It shows how out of touch. I'm guessing that most of my colleagues that will vote for Congressman Price have really never sat down with somebody that would think it's a really bad idea, not to mention immoral, to raise the Medicare eligibility age. So, Mr. President, I plan to join a lot of my colleagues in voting no on Congressman Price. I just think it's the wrong move for our country. I think it's the wrong move for particularly senior citizens in this country who depend on Medicare and on Medicaid, people of all ages. It's clearly the wrong move for our country. Mr. President, I yield the floor.